दिशा Badminton boys. Second place goes to Sahil Nayak of third year, Yashraj Petkar of first year. Of third year.
Our ex-Law Minister Ramakant Khalaf, matron of Goa Medical, Vice Principal, Madam Mangala, and friends, all my young friends. Well, today is a very, very special day in your life. A day where you have taken an oath with a candle. An oath that says that you are going to live a different life from tomorrow. An oath which says that you are going to be different people tomorrow. The life of a nurse is totally different. It's a very dedicated life. It's a life where you are pouring into human depth. It's a life where tomorrow, the moment you pass, you will not have to run after finding a job. A job is ready for you. In a world where people have, even after become graduates and engineers, have to run after jobs. It's an oath which will give you a situation where people will come running after you with the job in the hand for you. It's a place, it's an oath where you are going to live a life much different from all your colleagues in 10th standard, 12th standard and all that. Mind you, you have put all of them behind it. It's an oath where you will not only earn a lot of money, you are paid well today, but even when you retire, you are as effective or as good as ever. It's an oath where you will not only take care of yourself and your family, but you will also take care of your parents. It's an oath where tomorrow if you fall sick or if somebody in your family falls sick, you will hardly have to spend money because you are going to be amidst doctor, you are going to be amidst medical institutions, where you have the benefit of the health care. Otherwise today you don't know how much people have even sold their houses to gain health for themselves. You will never find yourself into such situations. This is where this oath is going to take you. A nursing life is a life, I would say L-I-F-E in capital. You're not just doing a job. You are living yourself into that job. You are living yourself into that work that you do every day. You know how to live a good life. And if you find people sitting there on days, here is Matron Malini who is supposed to be retiring next month. And you can see her as young as 25 years old. And you will all learn to live such life, because you know how to live. You know your medicine well, you know your physiology well, you know your health well, you know every aspect of the health thoroughly well. This is the life you are going to go into right from tomorrow. And you are going to live into this throughout your life. Friends, you just lit up the lamps now, which has reminded all of us of that great soul, Florence Nightingale. Born to very rich parents, had a very cozy life. Girls at that time did nothing but randa, vada, ushti, housewives. But this girl gave up all that and went out taking care of those ailing soldiers. And from then onwards, she stepped into this nursing profession. What did she do? At that time, there were no antibiotics. Soldiers, after thousands of them, used to die following infection. And this little girl, what she does is only keeps everything clean around her and saves thousands of lives, which would have otherwise died of infection and septicemia. We all know about it today. And then she went into that life to such an extent. The lamp was, even in the night, she used to take a lamp. There were no electricity. She used to take a lamp and go and take care of these soldiers. That's how you call her a lady with a lamp. That's how you, till today now, you lit up the lamp before you take the oath of this carrier. This is the only carrier except the ministers who start their career by taking an oath. Doctors also supposed to take an oath, but they don't take an oath like that. They're supposed to. They're not given an oath by anybody. They're not given an oath by their seniors. They're supposed to be taking. But you have taken that oath. You are into that. And I'm sure each one of you will be worthy of that. Each one of you will follow the footstep of this Florence Nightingale. That little girl gave everything that she had. At the age of 30, she was almost dying of tuberculosis. But she overcomes that without antibiotic, without anti-tubercular treatment. And she lives up to 90 years to take care of people. To set in such high principle for nursing that till today we follow many of those principles. Cleanliness first. Reaching the person, the patient first, understanding the patient, and encouraging him and giving him hopes. The spirituality in the medicine was born at this stage. Before that, medicine for us was okay, just prescribe something, just do a bandage, leave the patient off. And half of them used to die of simple infection. So friends, this is the life you are in. Okay, let's see. Suppose all of us love cricket. And today we are all on a cloud 9. We are on top of the world in cricket today. This week at least, having beaten Australia. Suppose cricket captain that just comes into Mafsa, or your Prime Minister comes into Mafsa. I would be first one to go and meet him if I can. And all of us would do that. Isn't it? Because they are the VIPs for us. And all of us would dream to live a life that they live. All of us would dream to be such a celebrity. But let me tell you one thing. A difference between you and these celebrities. The power that you have in your hands, the power to relieve somebody's pain, the power to heal somebody, The power to save a life is only in your hands. None of these VIPs have that power which you have in your hands. So take care of these delicate hands. That is the power you have, and exploit this power, use this power to take care of yourself, to take care of your family, and to take care of you people that you face around, the patients that you face around. Friends, who's given you this power in your hand? And I am always going to say this one little word, few words which I want to say now. Anytime I meet these youngsters, I keep on saying these words, because today I get so many patients. When the father comes and says, my son does not talk to me. Mother says, my daughter doesn't care about me. Why? Because in an age of technology, what happens is, if I don't know how to handle this latest gadget, I ask it to my son or daughter, and they spit it in minutes and give it to me. In the bargain, what they believe, that my father knows nothing. And this is a situation with a lot of you. But let me tell you, you are here only because of your parents. Right from a small kid to now. In fact, right while you were in the mother's womb till now, the amount of love they have given you, the amount of hardships they have taken because of you, the amount of care they have taken because of you, that is what has made you reach this stage. Till now they are spending for you. And of course, you do, in another 4 years, you can take care of themselves even financially. But at no stage of their life, they've allowed you to get out of their sight. At no stage, not even for a minute it must be. Even if you have to be out for a minute, the mother will be panicky and running after it. These are the efforts, these are the labor your parents have taken for you. And my friends, respect this, honor this. Anytime, if possible, whenever you meet your parents, try to touch their feet. Hug them, embrace them whenever you meet them. And the nature will only greet you with more and more success in your life. Any of you who will take care of their parents will never ever fail in his life. And this is one advice. Anytime I get a chance to talk with all these adolescent girls and boys, I would always say, and I would never forget saying it again and again. Friends, that is where you are. That is where your parents' level is. That is where your parents have taken you up. See, your life will be full of love towards your patient. That's what Florence Nightingale has taught us. And this love of yours with the patient, towards patient, and this empathetic feeling towards your patient makes you save your patient. Patient-doctor relationship is known. Patient-doctor saves a patient, but it cannot happen without a nurse in between. Doctor will write his medicine and go. It's a patient and a nurse who looks after the patient thoroughly well, understands him, gives the feedback to the doctor, and then accordingly the doctor is able to take care of his patient. So you are always in between patient and a doctor, and no doctor can do without you. The way Florence Nightingale has empowered you is by making you important. Initially, doctor used to write a prescription and the nurse used to give medicine. Today it does not happen. Unless the nurse gives complete feedback of the patient to his doctor, the doctor will not be able to do anything. this is where you are. This is your importance. So obviously, doctor's profession is called as a noble profession. And a nursing profession is called as the noblest profession. There is nothing compared to a nursing profession in that nobility, in that trueness, in your sincerity, in your dedication. Friends, I wish you all the success in your life, to lead a great life. I wish all your teachers that sight to see you grow up in your life successfully. And I wish all your parents that they would see you grow and become successful in your life. Thank you, friends. Thank you.